My name is Krystal Pong Dahl, and I'm the supervisor for the ambulatory care pharmacy services here at John Muir Health through the John Muir Physician Network. And I graduated UCSF School of Pharmacy in 2011. And the most important thing that I learned at UCSF School of Pharmacy is the value of the pharmacist on the patient's care team. And that was demonstrated to us by our stellar faculty and our superb preceptors who shared stories with us about their role on the patient's care team in their practice settings. And so for me, I use that every day, thinking about being on the patient's care team, being an advocate for the patient, asking the right questions, making sure that we're addressing their needs and concerns that are medication related. I remember it was either first or second year in pharmacy school, which at this point has been 10 years. Mary Ann Cota-Kimball, our dean at the time, gave us a lecture, and she talked about a patient who, despite the medical team's best efforts in increasing their insulin dose, the blood sugars were still through the roof. And so Mary Ann took the patient aside and talked to her. And through her conversation and after establishing rapport with her, the patient was willing to share with Mary Ann that she wasn't actually taking the insulin the way she was telling the team she was, because she was afraid of gaining weight. So that helped me realize that we can ask the right questions and get the right information that we need to make sure that the patient can take their medication safely and effectively. Because you really can't get that kind of information from the patient if they don't trust you and they don't understand that you're part of their team. I use that every day in our practice. Every interaction with the patient, every conversation I have with the patient, I make sure they understand that I'm part of their healthcare team and that I'm doing everything that I can to make sure that their medication regimen is safe for them and effective for them, and that they're understanding why they're taking their medications or what they're for, so that they can really get the best benefit from them.